For those of you who don't know, I'm Lauren Block. I'm a managing principal with Aurora Health Group and one of the co-leaders of Pathways to Resilience. Today's Learning Network session is about how states can effectively engage people with lived experience. We have two amazing speakers. We planned this session many months ago and are really excited. We have Cherene Caraco and William Kellibrew who will be speaking, and I'm going to let them introduce themselves. But before I do that, I just want to share a little bit about our goals for today's session. So primarily, we really want to help folks understand what meaningful engagement with people with lived experience can look like in a state policy context, and also consider what barriers that people with lived experience might face when trying to engage in policy making, and talk about ways that states can overcome those barriers or reduce those barriers, and then highlight some examples of policies that have been implemented and informed by individuals with lived experience. And we'll conclude with some recommendations from William and Cherene. We've also received a number of questions that we'll be addressing throughout. Questions about compensating individuals on work groups and participating in other ways. And so we encourage you to ask questions as we are going. We are not going to reserve time at the end for Q&A, so you can use the chat box to ask questions. Or you can raise your hand. Our team will be monitoring for that, and go off of mute to ask your questions. We really want this to be a dynamic session with active participation. So we're going to go ahead and get started, and I'm going to start with Cherene. And if you could just share a little bit about what brought you to this work.
Absolutely. Well, thank you so much, Lauren. And, full disclosure, I am a proud Pathways to Resilient expert advisory committee member. So it's great to be with you here in this capacity as a panel member. And, as I talk about my emergence into this work, I really do want to start with my personal connection to the effort around understanding trauma and the connection with people with lived experience, and then talk a little bit about how that has led into the work that I do. And so my experience coming into services and systems is actually not unusual. It's very much like so many people that I know. For me, it started when I was a child. So I was somewhere between 12 and 13 years of age when I first came into mental health services. And in the beginning, there was a really strong effort to give me a mental health diagnosis. I would end up throughout the years with what would be 8 mental health diagnoses. And so I have a long history of being involved in services and systems. And one of the things that was just so interesting to me as I reflect back coming into services as a kid is the unfortunate part about it is the entire time I was in services, I was actually experiencing a lot of abuse at home, and it was in the form of sexual abuse. And all of the indications were there, but the adults around me, the treatment providers and the other adults, looked at my behavior through the lens of pathology and focused really on the diagnostics, the clinical picture, focus on symptoms. And I received a lot of messages from a young age that I was sick and I was ill, that I was always going to be pretty much a mental patient. Without recognition of the signs that I was actually experiencing trauma. As a result of all of that experience, it really led me to want to understand, number one, how people recover. And so learn from individual people how healing occurs and how they recover from labels of severe and persistent mental illness and experiences with trauma. I also wanted to learn how systems and services work so I became a student. And for the past, it's been about 28 years, I've been working in and with mental health systems and services. I will say that as a result of all of that, I am a person that really disconnected as a child and had no childhood memories coming into about the age of 19 or 20. My entire childhood was erased. And I've spent many years healing from the wounds and trying to understand the impact that they've had on me. The last thing that I'll share about it is about 18 years ago, after having worked in mental health systems for over a decade, I started a peer-run organization. And I started it squarely because of this reason, because when people come into services, oftentimes we are pathologized and criminalized, and there are a lot of um, wounding experiences that come into play as a service recipient. And I wanted to create an opportunity to have recovery and wellness and healing. And so 18 years ago, I started a peer-run agency that now operates 18 different programs. We have over 100 survivors of suicide attempts, of involuntary commitment, of overdose, of houselessness, of long-term incarceration in federal and state prison. And now we serve our community. One of the things that that experience has taught me, though, is that it's not enough to just serve people. It's great that people come to an environment where they are surrounded by messages of well-being and healing. And it's great to see people individually reclaim their life. And it wasn't enough to then have them go into systems that were harmful. And so we got involved in system transformation and practice work many years ago, almost right from the beginning of our inception. So we do a lot of work in shifting the way service delivery systems are designed, services are provided, and the paradigm in which they operate. And then we realized that that was not enough, because if we are not involved in policy change and legislative change, we have a lot of system inequities that come into play. And so we got involved in more of the system transformation around legislative change and policy a handful of years ago. So I'm going to pause there because there's a lot that I'll share with you throughout our time here today, but I'm so grateful to be with you.
Thanks, Cherene. And I do want to acknowledge that a lot of engagement with individuals with lived experience is personal, and it's important to kind of create extra space for dialogue in that regard. And I want to thank you for being vulnerable and for sharing your personal experience with us. And I think this is a theme that will come up again as you guys speak with us more. So William, wanted to turn it to you to introduce yourself.
Thank you, Lauren. Really appreciate this opportunity to be with you all. Thank you to the team that put this together, and the Pathways to Resilience team, and thank you all for participating today. I see already as I look and scroll through the names, I can see some familiar names, a little bit of familiar faces, and I really appreciate having posted it. And maybe that was what drew some of the people that I know on. So welcome today. I'll just tell you a little bit about how I've come to this work, and also to my colleague Cherene. Thank you for opening it up. I feel way more relaxed, I would say, by you opening up. So thank you very much. But I came to this work much like Cherene, and having a childhood experience, or not knowing that it was named trauma or stress, toxic stress. I had no idea what was actually happening to me. I knew the feelings. I knew that I was feeling overwhelmed, and I was feeling felt very victimized by the things that had happened to me as a child. And in my bio, if you read it, I often talk about this, but I witnessed the murders of my family members in our family living room when I was 10 years old, and that really took away from me something that I couldn't describe. But later on, I would be able to describe that as my dignity, my esteem, who I was as a person, a human being, was really stripped from me, and so I had to try to rebuild that as a teenager. And as a teenager, I ended up having thoughts of suicidal ideation, and thinking that I did not belong on this earth. My anxiety was just so filled, and I just couldn't even breathe going to classroom or going down the street or playing games. It was very difficult because I was always hyper alert. And then I was put into therapy, and interestingly enough, my first ever therapist was my introduction to the mental health field. And thankfully for her name was Christine Pierre. Thankfully for her and for me, that was a really great experience, because I think about what kind of experience I would have had if that introduction had went south, in terms of a bad experience. But it gave me a chance to hope. It gave me a chance to think that, maybe I have a chance to live, and I will give myself another chance. And I did. And so I went through family therapy, individual therapy, group therapy, day treatment, hospitalizations, residential treatment. So in and out of systems, in special education. So I was struggling and struggling and struggling until finally I signed AMA out of the residential treatment center. I said, I'm going to go ahead and take this step. And I went to go get my GED, got my GED, got a job in the restaurant business for 9 years, and then went to school, became a student. And there is on the campus of the University of the District of Columbia is where I gained this sense of volunteerism and being able to advocate for the students who were struggling on school campus. And I really became a sort of a model for what it looked like to be able to make sure that the support was there for all students. Because I remember it took 3 times for me to enter school because I was afraid to finish the application process. But fast forwarding, it got me involved in victim services, and I started to weigh in on federal and state legislation on VAWA, or Violence Against Women Act, the reauthorizations. I started to get involved at the national level, and also joined the team with SAMHSA's National Center for Trauma-Informed Care to be able to work around the country with states and local municipalities around implementing a trauma-informed approach. And so I took my real story on the road with that group, and now have worked in senior leadership positions with the Baltimore City Health Department, being able to address the trauma and violence that was happening there in Baltimore City, and also beyond Baltimore City, because there are a lot of interagency work and local health departments across the country we worked in tandem with to think about what were their strategies, and really having that bouncing what we were doing off of others, so that we could all learn together and share what we were doing. And so I'll stop there and just say that that's really a lot of what brought me to this work. But being a voice and continuing that voice in spaces where oftentimes you won't hear from a person with lived experience is important for me. So I really value this conversation today.
Thank you, William. William, I'd like to start and ask the first question to you. And again, I do want to remind folks, as you have questions, please feel free to put them in the chat. We have a lot of questions, though. Some were already submitted. So the first one I wanted to start with is, what does meaningful engagement with policymaking and program design mean to you, William?
So what does meaningful engagement look like in policy design? To me, it really looks like, again, voice and choice. It's really having individuals who have lived experience or an experience of traumatic experiences of the past, not just trauma though, systems experience, of engaging systems, because they're the end user, or the people that have to utilize services. So what does it look like from their perspective? Is it actually working? Are the policies that are in place making an actual difference in their lives? How do we measure that? How do we keep that in the forefront of ensuring that individuals with lived experience have a voice, and then when they experience systems, that they aren't re-traumatized in systems? And I think that's really about meaningful. And then also, there are so many barriers that I know we probably will talk about this a little later, but there's so many barriers to being able to get meaningful voices engaged. And also, it's not just about surveys, really diversifying the way that we engage others. So I always think about the adult learner. If I'm sitting in a presentation, there's always the audio, the visual, the reading for the research folks, and then there's the kinesthetic, right? The movement. So think that, continue to focus on the ways that we engage in terms of communication, because not everybody's communicating, effectively, and language is so important in terms of communication. And so ensuring that we're not using the kind of jargon that we use every single day to fly over the heads of individuals who could care less about jargon. They've got the feelings, the words, and sometimes can't express those kinds of things. So how can we level the playing field and use mutual language to be able to engage, number one, so we can understand each other and have a shared language is so important.
So a follow-up to that, and speaking of jargon, Cherene, a question that came in from a participant is about using the phrase lived experience and using it generically. And they were wondering, when is it helpful to contextualize lived experience, and how can we combat the stigma that might be associated with some experiences? And the example this individual provided was substance use or severe mental health issues.
Well, I believe it's always important to contextualize lived experience. And, the unfortunate thing is that it's become such a coined phrase that it ends up having a very watered down meaning. When I see states that do this really well, first, it starts out with a real value of what that wisdom that can only be gained by going through this types of distress, the wisdom that that brings to policy, to service delivery system, to measurement, to outcomes that will not be available in the room. And so states that do it well start with that real value that we need that wisdom in the room, right? So it starts there. And then I see that it's also a very targeted type of experience that we're looking for. So as a suicide attempt survivor, if we are looking at how to mitigate or prevent suicide, how to find different ways of suicide recognition and prevention, it is really critical to have suicide attempt survivors in the room to help contextualize what are the challenges, the real life things that we are facing that created those challenges that we had in our lives. What were the things that were helpful and that were harmful? So really being able to evaluate what I call trauma in the name of treatment. What are the things that systems and did that actually made it worse? And what are the things that we can learn from your experiences to do it differently next time? And then thirdly, states that do this well are really open to the tension, right? There is going to be tension. To do this well, you're going to have people coming in with very different perspectives around what is helpful, what is harmful, around ideas that are very non-traditional, that don't typically land in services and systems. There is going to be an expression of distress and harm and woundedness, and you have to have a tolerance and an embracing of that tension. And so I find that states that do it well are able to recognize that if we're talking about houselessness, we have to engage people that have lived on the streets. If we are talking about criminal justice reform, we've got to be surrounded by people that have been in prison because they are the experts in that particular circumstances. If we were talking about overdose, you want overdose survivors to be in the room because they have a wisdom that I, as somebody who does not identify with that experience, I can't lend to that conversation. So I agree. It does have to be in context, and it has to be very intentional about the wisdom that people are bringing into the space and how we're utilizing it.
So I have a follow-up question that just came in. So someone is asking, they have convened a panel before of individuals with lived experience, and they said anecdotally that one young man who was part of the panel explicitly thanked the organization convening them for not making them describe their experiences in order to earn a place at the table. And I know before we did this session, I asked both of you, how much did you want to share, recognizing that it wasn't necessary for purposes of this event. But from your perspectives, and either of you can take this one, how do you balance including direct experience while not asking people to share more than they want to in terms of what they've experienced?
Yeah, I think I felt like, first of all, when in my story, I always, I knew it impacted me, right? And I've learned that my story has been very impactful for others. And now I empathize even more with the listener and the visual, the person who's looking at the screen. And I think about, what they might go through in terms of hearing this, because it can be triggering. It can be, let's see, emotionally provocative in one way or the other. So I just think about that when I'm talking, and not just say, oh, I want to get out what I have to say, but what is the listener actually hearing? And I do actually care about people who are listening to this, because when we finish speaking on this particular platform, they've got to actually go back and go and work through, their day. They've got to go back to their kids and think about what I've actually said. So I really appreciate the flexibility of not having to share, being required and forced to share, which is really the definition of violence, when we force or coerce somebody into doing things that against their will. So not having them be required to share, but also If hopefully, I think if we ask people to share that we've gone through some type of process around what it might be like for the audience to hear what it is that we're being able to share and work through that before we just ask somebody to share. Because sometimes when I first started out, I just would tell this story in graphic detail sometimes. And I used to get these evaluations, and people were, sometimes I saw where it could be very harmful when hearing it, when we didn't have the proper supports in the room to be able to address what might actually come up.
That's
Yeah.
really helpful, William, to hear not only about from the perspective of the individual sharing, but what the impact might be on the room. Go ahead, Cherene, I'm sorry.
Yeah, no, I appreciate you describing it that way, William. I completely agree. I'm going to take it into a different direction and say I stopped publicly sharing my story over a decade ago in terms of people asking me to come in just to share my story. And there are a lot of reasons why I chose no longer to do that. But one of the main reasons is that I would come into a meeting, I would be on stage, and people would applaud, and they would say things like, "Oh my gosh, you don't look like a mental patient," and "Oh my gosh, you are the exception to the rule," and you become that person that is not what they're accustomed to seeing. And first of all, I'm not the exception to the rule. I'm actually the expectation, because the majority of us do recover. And secondly, what I realize is when I leave the room after I share my story, the people that are left behind are making the real decisions. And I want to be the person in the room being a part of making the real decisions. And I also want to then use my lived experience to validate, justify, to share and influence what is happening in that room, to give the theory and the data relevance to real people. And so my cautionary tale is always that when we are inviting and engaging people in, to not reduce us down to simply our lived experience, because our lived experience is our superpower, right? That's part of what has created this wisdom that we have, but that is not the sum of all of our contributions.
Thank you. And Liliana's doing a nice job summarizing there too, in terms of the idea of tokenism, so that we want to avoid that. So Cherene, speaking about using that superpower and how you've used it to affect change or help affect change, can you speak to some of the policy changes that you've helped influence in the state of North Carolina as through your organization?
Sure. Well, there have been so many, but I'll focus on just one or two, just to kind of illustrate what we've been doing. So many years ago now, probably about 4 or 5 years ago now, a group of us, of suicide attempt survivors and survivors of involuntary treatment, allies as clinicians and family members, started coming together and forming our own coalition. And the first thing that we did was we wanted to examine the rates of involuntary treatment in our state. And as we dug in to that, we realized that the data was not readily available. So we had to find it. We are in a state that has 100 counties, and the data is coded. It's not it is not out there in terms of in written reports, so it's not transparent. But without understanding the depth of the issue, it would be very difficult to come together and prioritize and advocate. So we spent several months finding and gathering this data. As a result of it, we realized that our involuntary commitment rates in our state had increased by 91% over 10 years. And we had every data set from every county for 10 years of involuntary treatment data. And we put this out there for public consumption, and it got a lot of attention, as you can imagine. A lot of questions, a lot of reports, a lot of media attention about why our rates were so high, why they were increasing. As reporters started digging in, they realized that involuntary commitment means police involvement. It means shackles and handcuffs. So there are a lot of questions and concerns about this. That also got the attention of some legislators that came to us and said, we really want to understand this issue more. And it created a platform for us to work with legislators on redesigning and rethinking some of the systems that we have in place that are actually based on carceral approaches, not based on healing and wellness and recovery. As a result of that joint work, we ended up having 3 bipartisan sponsored bills submitted into the legislature that year. The first bill was an actual data collection bill. It should not have been as difficult for us to find that data. And so that bill was really devoted to transparent data collection, reporting, analysis, and everything that goes along with looking at data. The second bill that was related was funding alternatives to involuntary treatment, emergency department boarding, and inpatient care. So funding and piloting some of these peer-operated alternatives. And the third bill that came out of that was a non-police community response bill. So that one was really focused on first responders and how are we taking police officers out of the first responder role and really focusing more on connection and recognizing the role of trauma, historical trauma, cultural relevance, and creating some alternatives in the community for response when people are experiencing crisis. As a result of all of those, we were able to get funding in our local community to start our first peer-run respite. And the peer-run respite is literally a home in the community that serves as an alternative to inpatient and involuntary commitment. And so fast forward now, a little over a year later, our state, in partnership with some healthcare associations, is working together to now replicate the respite in another part of the state, which now includes looking at statewide policy, looking at funding issues that serve as barriers for these peer-run alternatives, looking at sustainable funding, some of the biases that we have around carceral care versus voluntary engagement. So that work now is becoming scaled in a larger way in our state. And it all started with a group of people with lived experience and allies looking at data and asking questions.
Thank you. Sorry, I lost my mouse there. That was wonderful. Okay, so next question. William, this is for you to start. And I know we've talked about this a little bit already, but what are some of the barriers that can arise when partnering with state and local government to inform policies and programs as an individual with lived experience?
Yeah, I think some of the barriers, I've written down a few things here. So I think one of the barriers is that, access to tables and boards or advisory councils and, structures that lend itself to being able to share experience and share knowledge and share wisdom. And I think that there's a lot of, barriers to being able to get on those boards. The relationship, when I worked for city government, the relationship between government and community sometimes was very tense, very tense. And you had people who may want to decide based subjectively or decide, who wants to be a part of this committee. And you see the same people over and over and over and over again. And not that those same people don't have any more wisdom, but I think that we have to continually to expand our reach to communities that don't have a seat on the board. So I think that being able to come up with a criteria to be able to expand that is often something that's going to expand the voices on there. So diversity in those boards is often a barrier to being able to invest in community leadership and get that wisdom to be able to to inform policy, the beginning of policy structure. So really the beginning of what we can do around getting policies through. The other thing I thought was a barrier was the disconnected political agendas that often seep into the real work, the work that's actually happening both inside government, but also externally of what's happening in government and community. So I think being able to have those, individuals who are civil service employees be respected is so key in this work, because they're doing the work on a regular basis. But oftentimes there's a barrier when there's a change in government. There's a change. I remember once, we had I served during 3 mayors in 6 years, And it was just always changing and changing and changing. I mean, the document that you worked on for a whole year would sort of be out the window next. So I think that's a barrier when we have those kinds of changes happen. But having individuals with lived experience at the table who can come at this in a whole different kind of way is ensuring that their voices are the ones that's heard, because policy is going to impact them just as much as it's going to impact the agencies, or even more. Um, so the barrier to capacity, the barriers are capacity to connect to the front line as well, because a lot of frontline workers and organizations often have that lived experience, and they're making those connections with community. And so ensuring that those community health workers are respected in terms of what they have to say. And I'll just say one last thing, because oftentimes being in senior administration, we have to do all of the paperwork sometimes to be able to foster, policy development or whatever it might be. But sometimes we don't have the time, or we say we don't have the time to really connect with those individuals who are doing the work every single day, but to always gain their perspective in terms of what that policy might look like as it moves through the local governments, the state, as well as being able to influence federal development of policy as well. So those are just some, not an exhaustive list for me. I don't know if
Yeah,
Cherene had
well
a
said.
thought.
Yeah, well said. I just have one to add, and that is the recognition that those of us who've been system and service involved, we have an equity gap. And that equity gap is awareness and exposure, it's knowledge, and it's resources, among some other things. Part of that equity gap, and William, you illustrated like your childhood so well and your experience coming up through systems. And mine is similar. When other people were in college learning about business, learning about social work practices, learning about research, learning about policy, we were surviving. We were in institutions. We were in the streets. We were just trying, for me, I was trying to stay alive. And I was trying to figure out how to gain some leadership over my thoughts and my nervous system, and not wanting to die every day of my life. We were surviving. And so we didn't have that education. I say we missed that chapter. We likely missed the entire book. But here's the thing with it, is it doesn't mean we can't learn it. But you can't expect somebody who did not sit in those same tables and have those same opportunities to be able to walk into these systems and just know it. Everybody learns by being exposed to it, and many of us have just never been exposed to it. And so we have to find ways to close that inequity gap of knowledge and of experience, learning what policy is and how legislative change is made. Are examples of some of the issues, right, that we face, in addition to some of the resource gaps of actually being at the table. The other thing that I would say is, it is a bi-directional learning. So not only do those of us with lived experience have knowledge and awareness and learning gaps, so do professional folks who've been in the systems for years. Oftentimes, when you're a provider, you are trained to see people as a client, not as a colleague. And that shift in perspective from client to colleague is a significant perspective differential. We have to expose our provider community and our policymakers, not to that we are sick and ill and broken and vulnerable, but that we are we are knowledgeable, we have wisdom that we could share that you really need in order to make these systems and services work. In order to do that, we have to retrain and do some unlearning of our provider community on things like cultures of inclusion, on bias that has been taught to us, as well as bias that may not be as obvious, or in hierarchy and invisible power and power imbalances that show up in services, but also show up in these spaces.
And can I add one last quick thing? And I think I'd be remiss, because I did write this down, is that we often have the isms, if you will, inside of you have the structural racism, like you mentioned, a gap in health equity. We're at the in Baltimore City. One of the things that the city council and mayor had passed was equity legislation. So every single agency now had to hire an equity coordinator, and so doing that work and just the awareness, Cherene, the awareness of the health equity gap and really defining what health equity was. A lot of people just didn't know what equity even meant. So we're doing we did a lot of and now they're starting to do undoing racism, which is something that hasn't been done in local government in this particular level of government across the board. So there's a lot of work to being able to understand the structural violence, racism, and the other isms that actually show up in institutions, in the bureaucracy, and create additional barriers for communities and for all of
That's
us.
right. That's right. And to build trust, right? We have to recognize it as well as be comfortable in naming it.
That's
So
right.
in the middle of these processes, when we see these imbalances come up, when we see that some voices are uplifted and other voices are not, we all collectively have to be comfortable to name it, to take a pause and say, ooh, we could do this differently, right? We have to have a commitment to do it differently, but it's uncomfortable. And so there is like an embracing of discomfort that goes along with this entire topic of how do you partner with people with lived experience? Well, part of it is humility. Part of it is awareness. Part of it is valuing differing perspectives.
Cultures.
And a
Yep.
lot of cultures embracing it, seeing the value added, but it's also being able to sit with discomfort and be okay with it. I always say if meetings simply start and end on time and they're very, very structured, we're not having a real meeting, right? We are having something that is externally controlled so that there is an end that is in sight, that is predetermined, and we're expecting that people co-sign on that. In order to do this work well, you have to dig in and get messy. And it has to be okay to be messy.
Thank you. Thank you both for that. The next question, and this is a question that was submitted by several different people. It's sort of a two-part question, and I know we have somebody from a state, Marianne, who's going to also chime in as we go. But Cherene, I'd like to start with you on this one. So we know that compensation for the time and expertise of people with lived experience is definitely critical to a productive and long-lasting relationship, and that people should be compensated for their time. So one question is just around how to think about approaching that. We know in Washington State, a bill was recently passed addressing this issue. And the sub question to that we also received is that this can be politically challenging, particularly when that lived experience is people who use drugs and compensation when that's a factor. So wanted to start with you, Cherene.
Okay, this is a biggie, right? So I don't want to start with the how until I start with the why. So I'm going to keep centering us back to why these things are important. So about personal wealth, like, it's important to give people, remunerate them for their time. Absolutely, that is a part of it. It says that we value your time, we value your contributions. But above that, it also disrupts power imbalances. When we're in meetings, most people that are there are being paid to be there, right? And so there is automatically a power imbalance in the room that occurs without everybody having the opportunity to be remunerated in some way. Most people are getting remunerated by their organizations, but many people with lived experience do not have that luxury, do not have that privilege, and don't have that opportunity. So I want to make sure we're going back to the core of why financing people for their lived experience and for their contributions becomes really important. So that being said, there are many ways to do this. So one would be contracts. So, for example, I have 2 contracts with our state right now as a consultant. So thinking about the various roles that people with lived experience play within systems can be training, it can be technical assistance, it can be policy development, it could be measurement and evaluation of systems, it could be an advisory capacity. I think when people think about the role of people with lived experience, they simply reduce it down to being on coalitions or being on committees. When I want you to think much bigger and broader about the various roles that people with lived experience can play in policy development, system evaluation, and measurement. If you think about it that way, you're talking about you can contract with people, you can have daily rates. I have seen some systems that will have like $100, $150 daily rate for the person being involved in a variety of different things. I have seen hourly wages So an hourly wage that is developed, and for every hour that you're contributing, whether that is a part of a committee or it is being on an evaluation team, that you're being given an hourly wage. I've seen honorariums, I've seen stipends. Of course, I've seen gift cards. I want to tell you about gift cards, though. We are at the point where it feels insulting. I'm going to speak for me. I'm not going to speak for William or the whole world of people with lived experience. But if I have to have another involvement in a big research study where somebody out of state comes in and they want to talk to me individually and they want to see my organization and they want to talk to a group of service users or people with lived experience, and then they say, I'm going to give you a gift card, right? The level of insult that feels, to me anyways, it just feels pretty insulting, partly because it's not an equitable thing. And partly it feels kind of icky. And so, obviously I believe very strongly that we need to create different ways of remuneration. I did find this example that came out of Toronto that I was really intrigued by, and it was something called the Lived Experience Advocacy Group, or LEAP. And what they ended up doing was recruiting people. It was open applications for a 2-year term, 2-year period of time, with specific lived experience based on, this was a poverty based effort, and provided them with training and support around their knowledge capacity building. And then they were utilized as trainers. They were utilized as conduits and liaisons between the community, direct community, and the state to be able to get information and do specific projects. They were organizing and participating in presentations, and they're doing projects that were specific to policy development, program, and service development. They were being paid $50 per meeting, $100 a day, plus the food, the transportation, and they were also adding childcare costs to it. So they were, in addition to building capacity, they were capitalizing on the knowledge of the people with lived experience. They were also capitalizing on the direct connection between community, which is, William, what you were talking about, that disconnect between what's really happening in life and in community on the ground. So they were able to close some of those gaps, and they were able to invest financially in the person and reduce the inequity around some of the resources. So that was an example that I really wanted to uplift with this.
I'll add one more example. One of the things that I was doing was working with the Brass Tacks Policy Academy that's bringing recovery supports to scale training and technical assistance center, right? And there's a policy academy that they had every year, and they applications were made by states who wanted to be involved in the policy academy, and so states would work on different things. And so New Jersey in 2017 worked on we're working on its I think it's this 1115 waiver for Medicaid, the Medicaid waiver, which would reimburse the responsibilities of work of individuals with the lived experience. And also at the time, 2017, I believe it was only 4 states that did reimbursement for peers. I mean, how respectful is that of the work that's actually happening when we're talking about individuals who are working in their opioid overdose recovery program? So I think it's important to be able to not just, like you said, Cherene, is, indignify the work by saying it's just worth a gift card, but you're doing work. And actually, it reminds me of this. I'm just trying to relax here, you all. It just reminds me of the only sort of maybe 2 instances, and maybe even 3 instances, that this country has even delved into the mental health field or behavioral health field in such a way that really we gleaned on a national level. Was back when JFK was president. With the community health centers, there was a big push for mental health, and then not until Bush did the Freedom Report that came out. And the one expert said that we knew that the system was very fragmented. We know that, but the one thing that actually we gleaned from that report was that peers in the field were the biggest advancement to the field that we had seen over time, but they still weren't respected to a level where that professionals in the field are already, or licensed professionals or other professionals were already being compensated in the field. So it was important. So New Jersey took the effort to say, you know what, we're going to build a certification program. We're also going to build training programs and guidelines and credentials, and we're also going to start paying people for their work. And so I believe their waiver went through. But that's only about 5 states now. So I think that what we can do on the state-based level is push more for those types of waivers to respect the work that's happening across the country. That's often not you can't be reimbursed for it.
That's right. That's right. I'm going to give you one more example around how what a state is doing, and that's going to come from my state. We are involved in a DOJ settlement, Department of Justice settlement, and a part of that settlement is that independent reviewer goes out and does an evaluation on an ongoing basis, talking to people that are directly impacted by living in adult care homes, living in congregate settings, living in institutional settings, doing system level evaluation and practice level evaluation. They reached out to us as a peer-run organization and said, do you have people around the state that would be willing to be a part of this evaluation team, this interview team? Our DOJ reviewer has a 100% team of people with lived experience that are part of the DOJ evaluation and assessment process. And the other example is right now, I'm working with Mass Tech in our state to evaluate. I'm a part of an evaluation and technical assistance and training team for community-based services around housing, tenancy support, and psychiatric rehabilitation. And so there are a couple of us with lived experience that are going out there and doing technical assistance and providing supports and training to the provider community as well as evaluation. So it is being done. I just find that it's being done in very specific ways and in pockets.
Very segmented, very fragmented in terms of what's happening in the field. However, we can glean from that and scale that, and so that more states or more states and more jurisdictions are taking that as a model.
Thank you. Thank you both. Thank you for all the really helpful examples too. I want to give an opportunity. We have Marianne McAvoy from the state of Pennsylvania on the line to just very quickly introduce yourself. And then if you want to share your perspective on how Pennsylvania does some of this work.
Yeah. Hi, everybody. Thank you, Cherene. Thank you, William. It's really great to meet you all. It's good to see some familiar names and faces, actually. So I'm Marianne McAvoy. For those of you who haven't met me, I'm the executive director out of our governor's office of advocacy and reform in Pennsylvania. I also serve as our child advocate for the Commonwealth. So I reached out to Lizzie after getting an email because she was asking me, what does Pennsylvania do when it comes to this? Because we've had a lot of conversations about making sure that we are really sending the message to our agencies and all of our organizations that there should be an expectation that they're going to pay people for providing support or having them schedule speaking engagements, things like that, when they have lived experience. So that's been the message. The only thing that's a little bit different that we do, we have a program called Resilient Voices, and it is sponsored out of our Office of Victims Advocate, which we work really closely with. And Resilient Voices looks at it through a slightly different lens. So we completely agree with everything everybody has said so far. The message really is we should always be prepared to provide compensation for these types of services, but we leave the choice in the individual's hands. So within the program, I actually have the website. I'm going to pop the link in the chat so you can see what I'm talking about. But within the Resilient Voices program, individuals can sign up and have all their credentials, their information added to this kind of hub, right, out of OVA, and they can state whether or not they want to be compensated. And the reason they do that is because if we're talking about people who are coming to speak about an experience that they've had as a victim of crime, we've noticed that some people actually reject the compensation. And I think that's a little bit different, right? Like we want the choice to be in the individual's hands. We honestly feel that it would be re-traumatizing not to give them the option of how they want to participate in this work. So I think there are a lot of people with lived experience who are victims of like sexual abuse, for example, who don't want to be compensated. I can say that I am one of those individuals, because for me, that feels like further exploitation after what I've already experienced. I think you used the word icky, Cherene. Like, for me, that feels icky for me. And I think that is the moral of the conversation, is that the control needs to be in the individual's hands who were asking to participate in this work. And we have to respect their wishes, and we have to respect their value, to what you were both saying. So they get to set their rates. They get to say how much they expect to be compensated for what different types of work. That's all kind of managed out of this program through OVA. Right now, the program is very focused on crime victim survivors, but they're expanding it to be a bit more general to trauma, people with lived experiences in trauma in a broader fashion. So we're going to be working together in the new year, probably, to talk about what that's going to look like, what kind of changes do we have to make to the application forms and things like that.
Thank you, Marianne. Appreciate your contributions to the conversation, and I see lots of good dialogue. We are in our final minutes. We got one other question that I do want to take, and then we're going to go to what we do in every call and get your 2 actionable steps that you recommend, Cherene and William. But we got a question, and I want to keep us focused because this is a big question. But Cherene, I'll start with you here. How do you feel about ACEs as they're becoming so prevalent that they're just a normal part of life? And we will do a whole other session about ACEs and screening and assessments and such. So whole other topic.
Yes. Yes. So I'll tell you, my feeling about it is very mixed. What I said yesterday, we were actually talking about this as a committee in launching one of the next sessions that we're going to be doing. And that is, first of all, I am so appreciative that there is research and recognition of the impact of trauma, that how prevalent trauma is, and that translation of what starts out as trauma ends up looking like mental health and substance use issues and some of the other social justice issues. So I am very appreciative and was very relieved when the research came to light and people were actually listening to it and taking it seriously. And I put myself in a situation that if I were at my doctor, for example, my primary care doctor when I was 13, and they did an ACE screening with me, and they were asking me questions about whether I'd ever been sexually abused, the fact that I was going through it right then and there would have been, in and of itself, I believe, incredibly frightening for me. Abuse is all about secrets. What's black is white, and what's white is black, and what's real is not real, and all of those sort of things. And to have in such an informal, such a formal setting, like a medical setting, where there is no real established relationship. Somebody asked me if I'd been sexually abused or was experiencing sexual abuse. I would have had a very different reaction to it back then. As an adult, having the screening, it lands completely different for me, because now I'm reflecting back on my childhood, and I have a level of appreciation that there is recognition that what happened to me versus what was wrong with me and everything that goes along with that. I just think we have to be very cautious and very intentional and about the unintentional consequences. If that had been opened up for me and I had named that I was going through sexual abuse, that would have likely led in a Child Protective Services report. It would have likely resulted in an investigation. I would have likely been removed from my family. I would have perhaps ended up in foster care, which is another system which has its own layers of trauma. It could have potentially added to my own feelings of guilt and shame that I was the problem, and now I disclosed it. And so I just want us to think about the impact of these types of things at different people's lives when we are just putting it into a space, but we also don't have the really good solid follow-up that is based on healing and not re-traumatizing people just by our response to what they're saying. Very similar to the conversation about suicide. How many people do not talk about suicide, are not going to call 988 or a crisis number for fear that if I say it out loud, I'm going to be hospitalized. Police are going to show up, or mobile crisis teams are going to show up and do a risk assessment, and I'm going to end up hospitalized, right? So we have to think about all of those things when we're talking about ACEs.
And I'm going to be very quick here. I'm going to say that, I am not my A score, and that's key. And number two, it should not be used as a screening tool, period. It should not be used as a screening tool and I'm not going to go into it because I think for all of the reasons that Cherene just mentioned, that we don't have the kind of adequate follow-up. I mean, I can only imagine those questions asked to the over 17,000 respondents who responded to that survey. What did they get out of it? How are they impacted by this? Again, it goes back to the very beginning. We talked about this is opening up those wounds. We have to actually do something about it. But opening those wounds and not having an opportunity to actually be responsible for asking that question is it can be very debilitating for the person who's actually asking them, and bring up feelings that they had never. I mean, the original study brought up feelings people had never ever felt, never told anybody before. Can you imagine not having the resources available before you start asking those questions? So that's just how I feel about it. But it's an opportunity for us to learn and be exposed to the prevalence, though, that's happening, in which there's some value in that. One of the things we did in Baltimore was we used the original ACE score as well as the expanded ACEs that Philadelphia ACE Project did. We used it on our child fatality review team. So we asked ourselves as a multidisciplinary team, what did we recognize in terms of the 10 ACE scores and the other 5 that we added on? We asked those questions of not only the mother, the father of the decedent, but we also ask that of the sisters and the brothers and the families around them, so that we can understand what was happening at this point, whether it was poverty, foster care system involvement. So we ask those questions, but not to re-traumatize the actual person that we're going to be asking that over and over and over again, without, again, the kind of follow-up that's necessary. Really quickly, we did an ACE. I remember being at Alternatives Conference, and someone did a ACE a session, and pardon my English, but all hell broke loose when when the questions started coming up on the thing. I mean, individuals with lived experience was saying, "Well, that's not me, and they kind of felt that, that tension between, just putting that information out and having people to think about it again without having follow-up.
Thank you. And we will have an entirely separate session about if you screen or if you don't, considerations either way. So we'll get to that another time. Finally, just very briefly, if each of you could share what you feel are 2 actionable steps that states can take to build a relationship and meaningfully engage people with lived experience. So let's start with Cherene.
I have 2. First one, planned engagement. Really strategize how you are going to intentionally engage people from, but starting, I would highly recommend that you start with your own readiness to engage people. Have an honest reflection on whether you are ready as a system, as a collective group of people, to engage people in meaningful ways, and what does that mean to actually do it. And so for me, planned engagement, it means assessing your own readiness, determining how you're going to recruit and make sure that it's equitable, looking at the various roles that people with lived experience, you absolutely need to be a part of whatever initiatives that you're looking at. Examine where the disparities exist, and mapping existing groups, individuals, collectives, and organizations that are operated by people with lived experience. You have resources. Oftentimes they're in local communities doing some really great, amazing work. So you might not know that they exist or where they are. So to do an intentional mapping process, I think would be great. Also keep in mind, a handful of states, more than a handful, have statewide consumer networks and statewide recovery community organizations. Just by virtue of who those organizations are, they are comprised and led by people with lived experience. Contract with those organizations as states to do some of this work, including inclusion of people. The second recommendation that I have is to close the equity gap. Really invest in emerging leaders to build capacity. Close that knowledge around what policy development is and how to do it, what the legislative action process looks like and how to do that well, how to engage legislators. Close the gap around organizational leadership and what it takes to be an organizational leader, and close the gap around community organizing. So offer something to people that is going to support them to further their leadership and further their potential efforts in this work in meaningful ways.
You won't believe this, but those are two things that I had on my list here, Cherene. One was really always including diverse group of individuals with lived experience on our panels, on our in our advisory board, in our work, hiring of individuals with lived experience, and ensuring that that's not something that's stigmatized when people actually say it, but it's something that's sought after in terms of what the job announcements might look like, right? The number two thing that I think is when we're writing grants, I remember just being in a silo of just writing grants without pairing up with organizations to really figure out what does this look like, instead of writing for people, but writing with community, writing with them to identify the strengths of the community. A lot of times grassroots organizations, people will have the wherewithal to get through. They just don't have the back end sometimes to be able to do that. So one of the things we did was in Baltimore was we came up with a community-based technical assistance arm, so that the community was providing support to the community, so that they were sharing those resources and sharing that capacity building. And that is so important when we're talking about supporting community, because a lot of big institutions always get big grants, right? Well, focus on really helping to build that organizational development and supporting individuals' lived experience who are in leadership and trying to be in leadership. And so just kind of create those those opportunities. I think those are the big. Workforce development is so key to me, and that's what New Jersey is doing. I respect the state for what they're doing around workforce development when it comes to community health workers. And
I'm so glad that you said, William, about supporting community to support community. So I'm just going to end with this in my perspective is a lot of times what will happen is when there's capacity building, the contracts will go to universities to teach people with lived experience how to run agencies and teach them leadership skills. This is not the type of leadership that we're talking about when it comes to mobilizing people in social justice activation and being a part of policy change. It's a very different variation. And what you want to do is invest in peer leaders, people with lived experience who have been in leadership roles, who have done this, and they have the skills to then reinvest in people with lived experience to learn relevant leadership and relevant skills.
we are them. We are you. We are each other. I mean, this is not a us versus them, right? This people lived experience, and we're walking around every single day. It's just that sometimes they don't feel they don't feel like they can actually trust the environment they're in to be able to say, I am a person with lived experience, but could be a CEO of an organization, or a professor of a university, or a leader in the community. So just being able to create that safer space for us all.
Well, thank you to both of you. I really appreciate all of your wisdom, both as individuals with lived experience and professionals with lived experience and professionals and everything else that you are, your superpowers. You've got lots of them. Really appreciate it, and want to thank everyone for joining us. Our next session is going to be, I believe it's December 15th, about how courts can be engaged. Trauma-informed courts. Will be featuring 3 individuals from different states: North Carolina, Florida, and Tennessee. So hope you can join us then. Please register. Thank you and have a wonderful afternoon.